Welcome to Medcast. Here, we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. I am Dr. Wafa Faisal. I am a consultant pediatrician in Dubai, and my guest for today is Dr. Rafif Tayyara. I'm very glad to have her in this podcast because she's a friend on the personal level, and she is a pediatric dentist. She is a healthcare expert, a book author, and a mom of three. Dr. Rafif, welcome to Medcast.
Thank you, Dr. Wafa, for having me today.
We are really privileged to have you today, and we're going to talk about a very interesting topic that is important to, I think, all the families, which is pediatric dentistry.
Yes.
Pediatric dentistry has always been like something interesting to me to understand more about it. So what is pediatric dentistry? And the question to you will be, what brought you here? I mean, tell us a bit about your journey.
So pediatric dentistry is a specialty, just like pediatrics, that dentists or dental students, they go for once they finish dental school or medical school. Okay. So usually what I did to be able to become a pediatric dentist is usually a training of 3 to 5 years where you really train clinically. Mine was at a hospital-based setting. So you train clinically and you learn also a lot about child psychology, but also in theory when it comes to treating and dealing with children of all spectrums. And this is something interesting. Yes. And important for people to know that pediatric dentists are also trained to deal and treat special needs patients.
Which is very important, and they have a lot of problems when it comes to their teeth.
Yeah.
Yes. So how many years have you been in this field so far?
So I'm gonna look very old now.
Oh.
But yes, I've been. I was counting actually because someone asked me also this question. I had a patient, a little child, who asked me at the clinic a few days ago, how long have you been doing this? He asked me.
Yes.
And then yes, I finished dental school. I became a doctor in 2005. Uh-huh. So it's been almost 19 years now.
19 years.
Yes. That I'm a dentist. Yes.
Long, interesting years. I think dealing with children is always a pleasure.
Very interesting journey. What we know, and I'm sure that you realize that early in your career, is that what we are trained to in the medical institutions are very different than what you actually face in your career.
Very true.
And you need so many, so much more in your baggage of tools to actually, survive in a career and succeed in a career.
Very true. And that's why the word experience is important.
Exactly.
When you get the expert, the experience is very important. It adds a lot to whatever knowledge you have or whatever career you are in. So, what brought you to Dubai? When did you come to Dubai?
It's a long story. I came to Dubai, I think 14 years or 15 years ago. I came by coincidence. I came actually through a personal relationship, and then I found myself just attracted to just starting my career here. I was interested to do my license, so I did it. I started actually, the journey for me started in Abu Dhabi 14 or 15 years ago.
Yes.
And then I worked there with a North American clinic, so we were all from North America. I studied in Canada, in North America, and then I just started my career there. And through the years, I shuffled a little bit my practice in Qatar and in Dubai and in Abu Dhabi. So for 7 years or 8 years, I was seeing patients in those 3 cities. And then in 2017, I just decided to stay permanently in Dubai.
Okay, and that's, I think, a great decision.
Dubai is completely home now.
Yes, Dubai is home, and Dubai is if you have a dream or something, or if you are ambitious, you will achieve it here in Dubai. There's something about it like that everyone can reach whatever he wants in his career, in his dreams. So to go back now into our topic, the first question will be why the visit for the dentist at an early age is very important. As a pediatrician, I can tell you that we know from the American Academy of Pediatrics that you have to refer the infants to the pediatric dentist 6 months after the eruption of the first tooth, or at the age of 1 year, whichever comes first. So from my experience, I will tell you that some parents, of course, agree and welcome the idea and visit the dentist, and their journey starts with a pediatric dentist there. And others, like, we feel they are reluctant or they are not convinced 100%. So they just think that if everything is normal and no problems now or something, they can delay it probably or postpone this visit. Why is it important to visit you or any pediatric dentist at an early age?
Yeah, so the key point is early. And by early, you know, like the textbooks or, you know, what we learn, you know, whether it's at the AAP, the American Academy of Pediatrics, or whether it's the AAPD, American Academy of Pediatrics, or whether it's the the World Health Organization, they all point that the visit should be early. But personally, and through my experience here, and knowing that the rate of cavities and the rate of, you know, the incidence of early childhood caries and the incidence of oral health diseases in kids, especially in the region of the GCC, are, you know, we are in a red zone here. So 80% of kids that I see every day have severe early childhood cavities. Knowing all those info, I think that even this recommendation should be revised. And what I know today is very different than what I knew a few years back. And my recommendation would be to actually send the pregnant woman or even the woman who is planning to get pregnant for an oral health counseling very early. Yes. Because we know today that you know, a pregnant woman or a mom expecting or even planning, you know, to have a baby in her life, if she is already at high risk, the baby is already at high risk. And we know already that the calcification and the genesis of teeth, you know, of the permanent teeth in a baby already finishes, you know, the genesis is done, the formation of those teeth is done at the second trimester, in the beginning, in the first few weeks of the second trimester. So I truly believe that waiting for the first tooth to erupt, it's already late.
Wow,
you know?
This is very new.
So I think there's a lot of prevention and counseling to be done.
Yes.
You know, why do we want to wait for problems to happen to fix them or prevent them? Let's just, you know, I think it's very pleasant, you know, for a pregnant woman or for a mom who is expecting to have a baby to put it on her agenda, you know, go do a cleaning, check if she has infections in her mouth, understand the link and the connection between her mouth and her body, you know, between, you know, the mouth is a gateway for the bacteria, for the viruses, for everything, you know, to the body. So why not take care of that door, you know?
Even during pregnancy, they are now encouraging also this counseling with the pediatrician before the baby is born.
Exactly.
And hopefully it's going to be added that they can get the counseling also from a pediatric dentist.
Exactly. And the newest research...
I support you in that. I support you.
And the newest research, a lot of people don't know that, but the newest studies, they confirm that gum disease is I think the 5th most common public health disease in the world. And poor oral health or poor gum disease in women and in men, in adult men and adult women, they can cause you know, cardiovascular diseases. They can cause thrombosis. You know.
So our health starts in the mouth.
Exactly.
Yes. Okay. Interesting. When the child comes to you, for example, at 1 year of age, you do the counseling. He gets used to you. So how often do you ask them to follow up, to come to you if the child is not suffering from a problem?
If the pregnant woman, you know, doesn't start that journey by herself, of course, the recommendation would be to bring the baby as soon as possible.
Yes.
We usually love seeing babies even before getting their first tooth out, because we want to explain to the mom, you know, all the issues about. So the first usually dental visit or the first, you know, trip to the dentist for a baby is not really about, you know, doing a procedure or, you know, checking something or examining something. It's really to do a whole counseling. So we talk about pacifiers, thumb sucking, you know, the bottle of milk, the breastfeeding, you know, the hygiene. Do we clean the oral cavity? You know, cleaning the tongue. You know, those things are super important. And just the fact that the baby or the child comes to the clinic and have a little wonder in the room and the clinic, this familiarity goes a long way.
It improves his experience when he really needs
Exactly,
the
and
procedure.
then boosts his confidence. And then we really want those checkups to be done every 6 months.
Yes.
So the recommendation is to come back every 6 months,
6 months.
because it's a very critical age. The 0 to 6 is a very critical age, and it's usually we call it that there's a window of infectivity where the child really catches and is susceptible to the bacteria that causes cavities.
Yes.
And usually it's really the window is usually between a 12-month and 48-month, and you really want to catch that window and give it
You
the
can
best
prevent.
scenario path. Exactly.
You can prevent this.
Exactly.
So how successful is prevention?
Prevention can be very successful if you start early.
Yes.
And if the parent or the caregiver has all the knowledge in their hands to be able to offer to their child the best oral health environment.
Yes. So you mentioned genetics. Is this like cavities or teeth decay, we call decayed teeth, something can be genetics? Can be related to the genes or heredity or
genetics is a factor. For example, you have kids who are born in families with their with a malformation or with a problem in the jaw developments.
Okay.
Right?
Okay, yes.
Like for example, if you have a child, for example, with a certain syndrome,
yes, of course.
or genetic syndrome where the
I
palate is
understand very
small,
well.
the palate
But predisposition to cavities, I think it's more a lifestyle.
Yes,
or
cavities in general are completely preventable.
Can be preventable. This is what I wanted to know. Yes,
and
so
usually
cavities can be preventable.
They
and
are
this is
related to an environment.
What we want to tell the people.
Exactly.
That's the reason.
And that's the point of raising awareness
early
about that.
And early visit. Yes,
it's true.
Yes, it's very true.
Yes.
So if the child now did not visit you early and he didn't have this what you call dental home with the dentist, but he has now at let's say 4 or 5 years of age a cavity, and he came to you, how will you deal with it? Of course, it's going to be more difficult, but still, I think you are trained to deal with them and to make it easier on them. And what if he required general anesthesia, which we are hearing a lot about it, and the parents are really concerned, especially when they have more than one cavity, and they come to us as pediatricians, they're like primary pediatrician, to ask us, is this laughing gas safe? Or so can you tell us a bit about it?
So we have so many tools, in dealing and treating kids who have cavities or they have certain oral health diseases. But we go gradually, right? So our first approach is usually what we are trained for basically, and which is what we call the behavior management technique, which is an array of tools that we have, and it's really pure psychology. And it's something that we do naturally to gain the trust of a child, whether it's distraction or, usually we have a famous technique called tell, show, do, where we would tell them. And if you go to my practice, you would see that I have big alligators, right? And they have a set of teeth. And usually what I would do is I would show the child what to expect when he comes to my chair on the alligator, so on the toy.
Okay.
So we would tell the child, you're gonna have to open your mouth, just like and the alligator would open his mouth, and then we're gonna count your teeth, and I'm gonna check, and it's very important to involve the child, right, in everything, and to empower him. And I truly believe that when you give the child the choice, the cooperation is much better.
Of course.
Now, of course, depending on the level of anxiety or apprehension of the child, we deal with the child.
Some children, they
exactly,
come anxious already,
on a case-by-case basis. And what I noticed through my career is that most of the time, the anxiety or the dental phobia, what we called, comes from the parent.
Yes.
Because
they are the mirrors.
Yes.
They mirror what the parent.
Exactly.
feel.
If the parent has had already a negative experience with the dentist, typically the child will do too. That's why sometimes if I see this or if I sense that, I usually like to separate them a little bit, or maybe let the parent a little bit get some distance,
especially one of them. If one of them is more
so
anxious,
I can
than
have
the other.
a little bit a closer or a better bond maybe with the child. Otherwise it won't work. And now we have also the next level of dealing with anxiety would be laughing gas or the nitrous oxide. and it's a super, super safe gas that we put with the medium of a flavored mask. So we have masks that can be, bubblegum flavored or
Nice.
strawberry flavored or chocolate
They're very
flavored.
advanced.
Exactly, or vanilla flavored. And then kids love them. And they bring a lot the anxiety down. And this helps us to not only have the child have a pleasant experience, but also to have extensive treatments, on the mouth of the child without the need to sedate him, more, deeper or go to a hospital setting.
Yes.
And now the next level, the highest
Yes.
level of sedation would be general anesthesia. But personally, I only use it when I have a very young child. So if I have a toddler of 2-year-old, for example, with a massive destruction, in his mouth and who needs really a total rehab, then I would probably advise, to go to the hospital, and we do it under general anesthesia.
Yes. So when you have multiple cavities, it doesn't require general anesthesia. You can even deal with it with this laughing gas?
Yes,
only?
of course, it depends on the age. If the child is capable, physically
Yes.
or age-wise, to sit
Yes.
on a chair and to accept
Yes.
the mask on his nose,
Yes.
then I would do it with laughing gas.
Exactly. Okay.
Yeah,
Nice.
but when they're
Interesting.
babies, they're not even able to accept that.
Yes. So thank you very much for giving us this idea about the journey of children when they have cavities. And the coming question will be about the mouth breathing. It's very common that many children, they cannot breathe from their nose, so they breathe from their mouth. What's the relationship between teeth, crowded teeth maybe, and mouth breathing, and if there is any?
This is a big topic, and this is something that I detect on a daily basis at the clinic, where I refer daily to ENT specialists, to ear, nose, throat specialists, pediatric ones. To be able to deal with that, because we have to understand that the relationship between the airway and the mouth is very, very close. In general, right, even in today's world, right, we live in more polluted cities. We live
Yes.
in, we have the use of air conditioning system that is increasing,
everywhere. Yes,
right,
yes.
everywhere in the world.
And everyone's suffering from breathing.
Yes, and
nowadays.
we are seeing every day in our practice an increase of kids suffering from asthma, from allergic rhinitis,
Adenoid
right,
hypertrophy.
from adenoids,
Yes, yes.
exactly, from big
Many
tonsils.
kids are going to surgeries.
Exactly, and even
Big
after,
number.
after the child has been operated, for
Adenoid
tonsillectomy or
tonsillectomy,
adenoids,
yes.
they need to have a rehab, right, of how to
Yes.
breathe exclusively
Yes.
from their nose,
Yes.
because I'm still seeing mouth breathing after the surgery happened.
Yes.
And
Very true.
we know
Me
very
too.
well, we know very well as pediatric dentists that a child who is mouth breathing at night, or who is grinding his teeth at night, which a lot of parents report daily to me, doesn't get an optimal development of his jaws. And in consequence, the palate, the upper jaw is, not well developed. It stays narrow.
Yes.
And if the palate or the upper jaw stays narrow, you don't have enough space for the tongue to go up and rest. And you also don't have enough space for the teeth to fit and align.
Yeah.
That's why crowded teeth are very proportional to mouth breathing.
Wow.
So
That's interesting.
yes, so that's why
Yes.
it's usually something on my checklist when I see children. I really need to look. Are they mouth breathing? I ask usually a lot of parents. They come to me and they're like, doctor, my child is grinding his teeth at night. I can hear the noise, from the other room. What's wrong with his teeth? And usually my answer, there's nothing wrong with his teeth. What's wrong is his breathing. He's struggling. He's on a fight or flight mode at night.
Yes.
And children who are mouth breathers, they don't get enough oxygen to their brain at night.
Yes.
And sometimes they are confused during the day to be the child with ADD in the class. They are, because mouth breathing also causes a deficit, an attention deficit.
Yes.
Makes you a child who is more agitated.
Yes.
Your concentration,
Affects the memory
your
also.
concentration focus
levels.
is less,
Yes.
right? Your memory,
The memory.
is less. Your academic score at
affected.
school is less. My child cannot sit still for 5 minutes.
quality
What's
of
wrong
sleep
with him?
will be disrupted.
Exactly.
Yes.
So now you see the label of ADD is just going up,
Yes.
right, in psychology clinics.
Yes.
But sometimes it's confused with, a simple airway issue
Very true.
that if solved, then, the child is better, he gets a better quality of sleep, right? And he's
And
literally
better
stressed
quality of
less.
life. Exactly.
Totally.
Yes.
Yeah.
So in the case of crowded teeth, what solutions are there? And what solutions you offer for those who are not breathing well, or you refer them?
Of course. So I work super closely with pediatric ENTs in town. Because I literally refer a dozen of kids exactly every day.
Yes.
And sometimes even when I refer, the parent had no idea that this was the problem. The pediatric ENT already detects big adenoids, big tonsils, deviation of septum. And then sometimes either they're medicated or they're operated. And you see when I see the child again 6 months after or a few months after, sometimes the moms tell me, like, my child is a different child. They see the difference, the mood, the crankiness goes down. He's calmer, he's focusing better, he's sleeping better. You know very well, even as adults, even when we have a good night of sleep, how much positively does it affect on our next day? So imagine for a child, right? Their energy level is different. So, beside what we do as airway management and, airway referral and airway issues treatment, what we also focus on is the early correction of the face.
Yes.
And by that is, if there's a need, we have to also correct the tongue posture, because a lot of kids have their jaws working perfectly well, but the tongue posture, what we say in English is that they have a tongue thrust. So basically, instead of swallowing, when you swallow, if you try to swallow, your tongue is in your palate, right? It goes up, it pushes right on your palate, and then you swallow, your lips are sealed.
Yes.
And a lot of kids, they keep the infantile, the baby swallowing pattern where they swallow to the front.
Yes, we see
and
them.
then they don't develop into adult swallowing, and this is what we call tongue thrust. So if you have a tongue after 2 years of age where it's still going to the front, then what you end up with is an open bite. So your teeth, they don't close on each other. And again, it affects the airway, it affects also the right development of your jaw. So that also causes crowded teeth. So we have to correct the tongue posture, we have to detect how the child is swallowing. And based on this diagnosis, what we do is we expand the jaws.
Yes.
We make room, basically. What we do is we do a maxillary expansion. So we widen the jaw, we widen the bone of the jaw, not the teeth. And by doing that, we have more space to fit the teeth, and we align them. So that's why what I do in my practice these days is clear aligners for kids. So we start clear aligners, and we start the early correction of the face as early as 4.
Wow.
Yeah.
It's too early indeed, but
it's too early, but it's needed. It's needed. And if it's affecting the sleep, if it's affecting the way your jaw is functioning, the way you're speaking, the way you're chewing, right?
Yes, the tongue, the swallowing,
it's very important. We really also, we can't ignore how strong, a smile is to a child's image and self-esteem.
Yes.
I have a lot of...
This is your focus.
I have a lot of children...
When I follow your social media accounts, I see you are focusing on giving that child the best smile, the smile he or she deserves.
Exactly. It's super important. I have children who wouldn't really smile to a camera, or who wouldn't,
because they know
smile in a birthday party or with their friends, because they're embarrassed and they are maybe bullied, in their class, or, with their cousins or friends about their smile. So it's so important, and it's more important than we think, because at the end of the day, children cannot express what they're feeling.
They suppress their feelings, and this can cause low self-esteem, which is the last thing we want for the children.
Yes, and there are even studies that show that early childhood cavities in kids can even cause chronic stress.
Yes.
And is a risk factor for mental diseases in the future. So why deprive them from the right of just having a white, healthy smile?
Indeed. What about vitamin D? How important is to the teeth in general, the health of the teeth?
Yes. Again, one of the things that we really go through, when we see kids at the practice, is their nutrition chart. I really love to go through that, because there are ingredients or food elements that the mom or the parent has never thought of that could be in relationship with, you know, the mouth of a child, that are indeed important and essential in, you know, the healthy jaws.
Yes.
And as you know, vitamin D is a very important element that not only is important for the healthy development of the jaws and the bone and the teeth, but is only important to absorb. You know, a deficiency in vitamin D will not allow you to absorb other vitamins. So that's why I go through the chart with them, and you know how, you know, these days, most kids have a vitamin D deficiency.
Yes.
So it's super important to keep the vitamin D on an optimal level, you know, in a child, because it helps me to, you know, ensure, you know, wide jaws, enough to fit all teeth.
Yes, great. So vitamin D is a very important vitamin to the children's health. Is vital, and it's very important for parents to take care of this and to prevent deficiency in vitamin D, because it affects the overall health, also the immune system, the bone development, everything. We come to a very, very interesting part of this podcast, which is the thumb suckers.
Yes.
As we know, when the child starts to suck the thumb, it's very, very hard to quit on this habit.
Yes.
And it affects the thumb, and it affects the jaw and the shape and everything.
Yes.
So advise us as even pediatricians, you know, how's the way? We tell them certain things that usually they don't work, and until the child reaches an age that he has to stop, but already some damage has occurred. And how do you deal with these children?
So, you know very well, thumb sucking is much more, you know, much harder to quit than a pacifier, right?
Exactly.
A pacifier,
That's why we encourage the pacifier.
You can throw it in the bin.
As a pediatrician, I encourage
exactly,
the pacifier. Later, I'll take your opinion.
100%, yes.
Yes.
I mean, one of the ways of weaning from thumb sucking is, you know, exactly, is using a pacifier.
Yes.
Because at the end of the day, a pacifier, you can throw it in the bin.
Yes.
But thumb sucking is, what I noticed in my practice is that thumb sucking is genetic. So most thumb suckers that I have their dad or their mom who was a thumb sucker.
Wow.
And if you look at the ultrasounds, right, in the mommy's wombs,
from the womb,
exactly, you would see that the babies, you know, are already thumb sucking.
Exactly.
So we know very well that sucking for a baby and for an infant is a reflex, right? It's a reflex that is needed for them. You know, it's an oral, exactly. It's an oral need that they need to have until a certain period of time. What worries us as pediatric dentists is if that habit persists over a certain period of time. Usually, we would like a pacifier or a thumb sucking happen to leave them out.
What age is?
Usually, we would like them to quit the habit around between 12 months and 14 months.
Unfortunately,
right?
all of them continue.
Exactly. Unfortunately, it's a habit that lingers.
Yes.
It's really up to the parents, you know, to a little bit work on that. What we advise for pacifiers, sometimes what works very well at my practice is what we do like a goodbye ceremony.
Yes.
So when the child is a little bit able to express their needs, or you know, they are a little bit social.
Children are smart nowadays.
Exactly.
At an early age.
Exactly. So what I like to do, and what I see it works very well, is that we involve them in the process of saying goodbye to their pacifier. By empowering them and by telling them, you know, you're a big boy now, you're not a baby anymore, and then you're upgraded, right, to a higher level. Let's, for example, grab all your pacifiers in the house, in the car, in the nursery, and you know, we bring them to a big boy or a big girl toy store, and then you can exchange them. You know, it's like, you know, going from you know, grade 1 to grade 2, you know, something like this. The idea of having it as an upgrade and not as a punishment is super important for a child.
And it comes from the child himself.
Yes, because you don't want him to see it as, you know, they're punishing me by removing this.
It's human nature. If you prevent something, you will like it more.
Exactly. So I really like this technique, and it works very, very well.
When it comes to thumb sucking,
when it comes to
a goodbye ceremony
when it comes to thumb sucking, you know, talking about it helps a lot. You know, what helps also is giving them another way frequency of physical affection, like for example a teddy bear,
Yes.
or something to
Or
hug,
maybe the
or a
pacifier if
blanket.
the age is still allowing
Exactly.
us.
Something, yeah, there are even some therapists who talks about hugging sessions, at bedtime, in order to reduce the frequency of
Thumb sucking.
of thumb sucking, and
Yes.
and actually, like, studies show that they work.
Yeah.
But usually it's a very, very strong habit to to get rid of. And usually our last resort as pediatric dentists, we have something called a thumb sucking habit breaking appliance. It's a device that we actually place in the mouth of a child that stops the habit in a week. In a few days it stops, because it has an obstacle in the top of the palate, that we actually place, where the child, even when they try to put their thumb inside their mouth, they cannot anymore have the pleasure,
Enjoy
the
it.
sensation
Yes,
of
yes,
sucking.
Of sucking.
So
Exactly.
we see the habit going in a few days, and then we keep that device for a few months, because we also want the memory,
Yes, to forget.
the biofeedback
The
of the
come
habit
back.
that lingers away, and it works.
Yes.
But this device, I would never put it in the mouth of a child without his consent and without the consent of his caregiver, because I want the child to be in a mental state that, we're trying with them at home, but we're not succeeding, and he's now ready to get help from his dentist.
Exactly.
If this is the case, then I would do it. But it's never a technique that, I'm just jumping into it and I'm imposing it on.
Yes. To summarize this, pacifier is better than some thumb sucking,
Yes.
and can be offered to the child if we notice this habit,
Yes.
even if he was not using it before. And both should be stopped before 12 months of age, so that they'll not affect the teeth eruption.
The development
right?
of
the
the
development
jaws
of the
too,
jaw
right?
and
Yeah,
everything.
because you
Yes.
usually end up with having an open bite,
Yes.
usually having this gap between
Yes.
the teeth, and that affects speech. They don't pronounce certain letters later. They don't breathe well,
Yes.
and then they have this bite that that you call rabbit bite,
Rabbit
that
bite,
they have
yes.
in the future. So you really want them
Yes.
to avoid that, right? And a
Exactly.
little tip, I think, for moms who are using pacifiers, I think it's super important to, when a mom buys a pacifier, which I am, for example, I have a baby, I have a 9-month
Yes.
baby, and she's using a pacifier. So I'm not against pacifier, but I'm all about, the moderation in using the pacifier, and how intense the baby is using, how intensely
Yes.
the baby is using the pacifier, how long, the duration of periods, right?
Very
And
true.
how and what kind of pacifier am I using? And those are very important things to look for when a mom shops for a pacifier. One of my tips is, even when you're, how when you go buy a pacifier, you have stage 1, stage 2, stage 3, and the higher the stage, the bigger the pacifier is. So one of the tips that I advise moms is stay on the stage 1 pacifier.
Yes, this is what I did with my 3 children.
Exactly. So when you stay on a small pacifier, the
Yeah.
damage is not
Yes.
as big as when you go to stage 3. They're really, really big.
Yeah, it's very
You know?
smart, and the child will be. I didn't have any problem also with my
Yes.
3 kids. They all use the pacifier. Between 6 to 12 months, we were like cutting
Yeah.
on and decreasing.
Exactly.
The
So it's
duration
all
and-
about how smart
Yes,
you are
yes,
dealing
yes.
with them.
Yes.
And also stay away from heavy pacifiers. So I see a lot of moms, they have the pacifier for the baby, but on top of the pacifier they have a toy hanging,
Yes.
or a rope or chain
This is not
hanging.
needed at all.
And now
I say this
there's
is
so
heavy.
much trend in the industry. You
Yes.
you have like almost you have almost
I mean,
furniture
it's-
coming out of the
yeah,
pacifier.
exactly.
And the heavier it is, the more trauma you're
Trauma
causing
it
to
will-
the inside
it
of the
will
mouth. So
cause, yes.
try to stick to, simple, light
Yes.
pacifiers where the nipple is like very, very, light and flexible. It's a good thing for
Yes, it's
for
a
the
good thing.
mouth, and
Yes.
the teeth.
So we spoke about pacifiers, and we spoke about thumb sucking, and we know now. So we are reassured that if nothing works, if it will not work by, talking to the child and whatever other methods, there is something a pediatric dentist can do, which is
Yes.
this device, although it's the last resort, we can say, but there is something to stop it, because we cannot continue with this. However, I could have asked you this before, but I will ask you now. Some advices for the dental, for the mouth hygiene, for dental health. The children, how many times they should brush their teeth.
Yes.
There are basics, I know, but still people like to refresh their memories, and
of
if something
course.
new has any new recommendations in this
Everyone
regard.
needs to hear it, right?
Yes.
Yeah.
And
so
continuously.
I think the earlier we instill, the habit of taking care of your smile, the better, because early habits, right, start early, and good habits
stay forever.
stay for life. Exactly.
Yes.
So it's super important to instill those habits as early as possible. And what I find very interesting is that, as an infant or a baby or a child, babies observe their parents. And if you as a parent take care of your smile, right, and you brush, you floss, they see you, right, going to the bathroom and doing this oral hygiene routine, they will do it too. So it's a matter of common sense. So we do want every child to brush their teeth morning, after breakfast, and before bedtime. We want them to use a toothpaste that has either fluoride or hydroxyapatite. The two elements are very good because it's an ingredient that remineralizes the teeth. And we want them to start flossing once the back teeth, are close to each other. So those are very interesting routine. And one thing also that is very interesting, I think, for parents to know is that practice tongue cleaning, with your child as early as possible.
Yes.
Even for my baby, I brush their tongue.
Yes.
Brushing the tongue has a lot of microscopic, valleys in it, and it catches a lot of bacteria, viruses, fungi, and it's the number one cause of bad breath.
Yes, which is another interesting topic
And
as
it's
well.
also puts you at high risk to have a sore throat.
Yes.
A throat infection.
Throat infection.
Exactly, a viral
Pharyngitis.
infection.
Yes.
So it's very important to encourage kids to start cleaning their
Yes.
tongue with a tongue cleaner or with a toothbrush,
With a toothbrush. This is
as
what
early
I do.
as
Yes.
possible.
Yes, very nice. There's a layer they put for children to prevent cavities also and caries.
Yes, so as a preventive therapy, right? As a preventive
At what
strategy,
age? At what age?
we start as soon as we have the set of teeth.
Okay.
In their mouth. You know how some babies have their first tooth at 6 months.
Yes.
Some babies, like my twins, for example, they had their first tooth at 16 months.
Yes.
Right?
So there's
really,
a range. That's why.
There's a range.
Yes.
So I don't really like to stick at an age because they don't
2 to 3
exist,
years
right?
is
We
a
have
good-
there's a big
Yes.
fork.
2 to 3 years. This is in general, or
Yes,
yeah.
we like to
Yes.
start fluoride varnish
Yes.
or remineralization
Yes.
agent, as soon as we can, especially with the diet that kids here are eating.
Yes.
Birthday
Yes.
parties, loss of acidity, loss of sugar.
Yes.
Kids these days are consuming 5 times more the dose of sugar than they should.
This needs another,
So, can you
another
imagine?
episode to speak about.
Yes, and there's a viral
sugar
video that I did
consumption
actually
and- yes.
about crackers, that crackers are the most common cause of cavities,
Yes.
not sweets,
Yes.
not sugar.
Not chocolates or ice creams, probably crackers.
It's the sticky carbs.
Yes, the sticky carbs. So now also we we have a book in our hand.
Yes.
And this book is called Dr. Smile.
Yes.
And this book is interesting.
Mm-hmm.
And it is about you, but you are the author.
Yes.
So who is the audience of this book?
Mm-hmm.
To whom you are writing? And what's the objective behind you writing a book?
So I just
Called
published
Dr.
actually
Smile.
this
I love
year.
the name.
Yes, thank you. I just published 2 books actually, one in
Yes.
English, one in Arabic.
Okay.
And it's called Danny and Sarah Go to Dr. Smile. Danny and Sarah are my twins. And
God bless them.
And it's a children's book that actually tells the story of Danny and Sarah, twins, going to the dentist for their first trip at the dentist. And I thought, because I deal with a lot of anxious kids, and this anxiety is often transmitted from the parent to the child, I noticed that the best way to deal with that anxiety or that phobia is by, having it as a bedtime story or as a story at home.
Lovely.
To show all the details and, what the child can expect by having his first trip at the dentist.
And of course,
So
there'll
it's
be
a lovely-
messages inside.
Yes, there's a lot
yes,
of messages about health,
Yes.
about the why, I have a very famous page that, talks about the sugar bugs, in your mouth and what they
Amazing.
do.
Brilliant.
I try to narrate it. My twins actually helped me a lot, telling the story,
Yes.
because I really wanted to tell the story through the, the mindset of a child and not through the mindset of a
Yes.
dentist.
Their own
Because-
language.
Exactly.
Yes.
Yes.
From their
yes.
perception.
Yes, exactly.
This
And
is
it's
brilliant.
beautifully illustrated.
I can't wait till
yes,
I
but-
read
but-
it. I want to read it myself.
Yeah.
Yes, and the name is very interesting. So the smile, as we said, is very important.
Yes.
And your smile is very important to our podcast, Dr. Afif. And
Thank
we
you. Thank
we
you,
enjoyed
Dr. Wafa.
everything in this podcast, all the information. We need probably more and more episodes to talk about everything, because we didn't cover some important topics as the bad breath and these things. But it was really lovely having you, and the information are very valuable. Thank you very much.
Thank you so much for having me.
Thank you.